Talk a little bit about exactly where you guys get your stem cell and what it is.
Comes from a woman that's donating their placenta from a C-section. Between the ages of 18 to 25, they come, we vet them, go through a whole process. They're unvaccinated women.
Well, for me, it was more preventative. Our amazing orthopedic specialist looked at my knees and he said, Christina, if you don't want to have a knee replacement by the time you're like 45, like, why don't we do this preventatively?
I always did that Batman shift because I couldn't move. I would have to, if someone called my name, I'd have to go.
Speak like that stiff neck, can't move. Yeah. I also did the facial, right?
Got him to do the facial, guys.
Did the facial.
Not gonna lie, he's been staring at himself through the TV,
I don't know,
guys,
it looks kind of good.
And we're like, uh-oh.
Welcome to another episode of Power Alphas. I'm one of your co-hosts, Sabby Piscatelli. And as always, I got my beautiful, beautiful, beautiful wife, Amanda Piscatelli. How you doing, baby?
Doing good. Thanks for showing up for work today,
I know.
babe.
You had a couple episodes without me. Did you miss me?
I did miss you. It was actually kind of weird filming without you.
Did you do my intro?
No, I actually totally did something different. Ben knows.
Sabby, I missed you, bro.
Ben, did you miss me?
I missed you, bro. I missed you.
Because she didn't miss me, so I don't know.
Hey, she had fun. She had fun.
She had fun.
We were
She had fun, like the
taking
only
shots.
host. Like she thought she was the shit, didn't she? Yeah, she thought she was cool.
Well, it's cool because our banter, like back and forth, we have our, I know where I'm good at, you know where you're. That's why we're such a good team. So I just felt like it was a little different on
So
my
you had a
own.
real structure then,
Oh,
like
yeah.
bullet points and shit.
ChatGPT saved my ass.
That's awesome. Well, you know what?
Anyway.
I'm so excited to get this episode because something that falls under our umbrella, our lifestyle, what we preach, what we live by, anti-aging, health is wealth. We have a story to tell because I'm excited. Anybody that follows us on social media, we were kind of doing it as we were there live a couple weeks ago. But we were going to talk about our experience in Cancun at the new stem cell center called Rejuve. And we're going to dive into our treatments. But first, I want to ask you, babe, how was the experience? How do you feel? And would you go back?
Oh, 100%. We had such a great experience in Cancun at Rejuve STEM. Sabby and myself, we do obviously take pride in our health. And we actually were introduced to one of the founders, John Marola, by your friend Sid in this studio.
In the studio.
So that's kind of how it happened, which is really cool. His story, just to, a little synopsis of it, he had some neck issues and he was literally moving his neck fluid.
A week later,
he's like, no, you got to go. And I have neck issues. So obviously that sit home with me. And I was like, wait a minute. So we obviously got in touch with one of the partners at Rejuve STEM, and we got really friendly with them really fast, and they literally treated us like family from the moment we stepped off that airplane. And the whole experience was amazing. We're going to get really deep into it and explain what we did. But my overall experience was amazing. I already feel great. We're going to get into what we did specifically, but I feel really good so far.
Yeah,
It's
I think you hit a nail
week.
on the head. Us athletes or former professional athletes, we kind of have a culture and we kind of talk within each other. And the thing is for us is what's important is when you go to these treatment centers, right? And the reality is everybody wants to say, oh, we have the best treatment. Oh, we want to treat pro athletes. And it's how you feel when you get there. And it's how the transparency of the treatment is and the vibe you get. And I think that is a huge part in absolutely telling your other co-athletes or co-professional athletes that you work with, hey, man, you got to go to this place. Not only does it fix you, treat you, they treat you like family and makes you very comfortable. And I think that's a huge part when you want to do treatments like this that is not cheap, right? It's not cheap, but you can't put a dollar amount, in my opinion, on your health. So for me, it's something that is, I'm actually excited to dive into it. But we actually have a special treat for you today because not only do we have the guy we met and his beautiful wife, we have a guy who's going to introduce himself, how he became partners, how it changed his life, and we're excited to introduce John and his beautiful wife, Chris. How you guys doing today?
Good. Thank you guys for
Thanks for joining us. They got their Rejuve shirts on. Look at that. Actually, Mandy's got her on.
Just brought
Awesome.
my props out. No, we're really excited to have you guys on here. We appreciate you coming on. It just happened to be kind of convenient that you were going to be down here. So we were like, wait, let's get you on the podcast. Let's talk about our experience. And you guys can be the experts. Obviously, you're more the experts in this field of explaining to our followers, what the treatments and what we did and the benefits and kind of your story as well. And that's what I want to kind of start with. If you don't mind explaining a little bit of your story.
Dive into that, John. Tell us about how you even got involved, becoming a partner, now co-owner, but talk about what you went through in life to get there.
Yeah, it's funny because Big E, one of my best friends from WWE, last year told me about Rejuve, and it was kind of, I told my tricep while bodybuilding for so long. I kind of just put it off because I partially tore it, and I finally ruptured the tendon fully. And I always had back issues. I had herniated discs throughout my whole spine. I had bulging discs in my neck. It was so many issues I had. And when he told me about going, he's like, John, after your surgery for your triceps, go for treatment just to see how you feel, just to see what you could do for you, see what can happen because of all the injuries. And I went with Christina to Rejuve in Cancun.
Hold on. At first, he said, I don't think I want to do this. He never spends money like that on himself. He'll buy people a house, like, he'll help with cars, do all this stuff. And I said, babe, do something for you. Like, this is something that you really need to start looking at because, we have 2 small kids. I'm like, you got to be able to get on the floor and play with them. You have to be able to throw a football with your son, when he gets to, that age. So I said, no, you need to do this for you. So I nudged him a little bit,
I'm very
but
grateful for her because I was pushing it off. I'm like, no, I was like, I'll just deal with the injury. I'll deal with the back issues and just whatever. And she was like, we always say it now because it's a big part. It's like kind of invest in yourself.
Absolutely.
Take that leap. And that's what it was. And we went. As soon as we got there, my partners now just picked us up from the airport. Took us to the hotel, took care of us the whole time. And it was getting going through the treatments, going through the protocols. Everything was such an easy, not transition, but it was just such an easy protocol. It was just an easy transit to the hotel, to the clinic, to everything. And literally after I did my whole back, I did my neck, did my triceps, and I went back to the hotel. The next morning, I'm sitting on the balcony, just overlooking the ocean. She's inside getting ready. And she calls my name, and I look like that. I was like, what's up, babe? And she runs out to the balcony, and she's like, babe, you just moved your neck.
Oh my God, I have chills.
Wow,
Yeah, that's crazy.
I didn't even think about it. I was like, holy shit, I did. I couldn't believe it. And I always did that Batman shift because I couldn't move. I would have to, if someone called my name, I'd have to go.
Be like that stiff neck, can't move. Yeah.
Move. So it was just such a breath of fresh air. I'm like, this is how you're supposed to really feel. This doesn't make sense to me because I always thought this is what you have to live with.
You were probably so used to
I was so
feeling
used
like
to
And you're still
shit.
young. I mean, young. Yeah, you're only 40. Come on, man.
Yeah.
You got another 45 years to live.
Yeah, for real.
So after that, like literally we came back, but we didn't want to leave. That was the big thing. It was like my partners now and just the doctors, the medical director, everybody there just felt like a family. Like you guys said.
And when you're down there, you just feel like it's such a retreat. Like I remember being there and seeing him like undergo all this after seeing his neck turn. And I remember just like tears filling my eyes and I was like, wow, this is like real. It touched my heart. Like
100%.
they always say that people forget what you do for them, but never how you make them feel. And like that's exactly what it was. They made us feel just so taken care of.
Oh,
you know?
I love to hear that.
love that.
And talk about, so obviously it was so impactful for your life that you wanted to become partners. You wanted to become co-owner. Talk a little bit about that because again, they weren't selling you nothing.
No.
But now you want to help others, right?
No,
now you know it works.
That was literally what it was. It was like we came back. I'm like, I don't want this to be a one-off. I don't want to just send 1 or 2 people to you guys. It's like, I want to be part owner of this. I was like, I want to be involved because I want to help as many people as I can. And literally I called them probably 3 weeks later and they were kind of in shock. Like, you serious? Like, this is big. I said, absolutely. I was like, I am dead serious with this. I'm like, this could be life-changing for so many people and I can't wait to be a part of it. And they were all in with me. And we just went from there. And it was literally like a month later, I started treating people. I started going down to Cancun to help out.
Oh, wow.
That's a beautiful
away.
thing.
That's awesome.
And-
man.
But we had such a connection, all three, me, Vivek, and Sharad. We just had such a connection together. It was easy.
Yeah.
Yeah.
It was like, okay, great. You ready for this? Yes, absolutely. Let's go. I went back the next month and started going to help out with the patients.
Oh, wow.
Well, that's what I felt
Easy.
from not only you guys, but obviously Sharad, right? I was
Sharad.
And everyone else there is that like, the comfortability and the authenticity of you guys as well. And I think it goes a long way. And I spoke with Biggie, actually. He reached out to see how it went and all that. And that was the first thing he said too about you guys and how passionate you are about this. And I think that goes a long way because someone who's passionate about something, you're not just looking for, to make some money here and there, right? Obviously it's a business at the end of the day, but when you actually are passionate about helping people and, you have the results, the results speak for themselves, firsthand, and then seeing someone else be able to turn their neck like that or whatever it may be, it's very inspiring. So I think that's really awesome that you guys were part of it.
Thank you. I appreciate it.
No,
So
for
tell
sure.
me about your treatments. I know you said you got a couple as well, right? What have you done?
Yeah, I've done my hips and my knees because our amazing orthopedic specialist looked at my knees and he said, Christina, if you don't want to have a knee replacement by the time you're like 45. Like, why don't we do this preventatively? So for me, it was more preventatively, whereas, John was injury and obviously just wear and tear. So I did mine preventatively, and my
I like
knees
that.
feel great.
Proactive. It's being proactive about your health. We're
proactive,
huge
not
on that.
reactive.
Yeah,
Yep,
because
not reactive
at
sometimes.
this point, like I'm not middle-aged yet, so
I'm not up there yet.
I'm not getting there.
Me and you
but
But at
can
least-
say that we're not up there yet
that's
with them.
even more important in my opinion, because now you're being proactive instead of reactive.
Absolutely.
And your body's gonna, be happy about that. That's something that is that's I love that.
yeah.
I love that,
I
man.
think a lot of people should be doing that instead. Everybody waits to
sure.
get hurt. I feel good.
100%.
Right.
I feel good. I feel great. Oh my, nothing's bothering me. Well, maybe I feel a little bit today. I feel better tomorrow.
Yep.
That's the thing. Don't do that because it's gonna end up being bad. Just take that leap of faith and kind of like, hey, you know what? I want to be proactive. I'm gonna get ahead of it. Let me just go get an IV. Let me do something because it's gonna end up in the long run being the best option you ever take.
Absolutely.
It's the best thing you could do, and that's like you said, I'm very passionate about it because I've dealt with injuries for so long. I was born with malrotation of the intestines, which we've discussed. I've been dealing with so many issues for such a long time, and it'll change my life. It literally changed my life so much.
There's like
so.
such a light in his eyes from helping people that I just can't, as a wife, and I've known my husband forever. As a wife, like I can't explain it. Like it's just beautiful.
That's
like,
what it's
to
about.
witness
Really
that.
is.
Yeah.
And that's really cool that both you guys wanted to be part of something of life changing for a lot of people. Before we dive into all the treatments you got, I want to ask my beautiful wife, babe, talk a little bit about the treatments you did, and how you're feeling right now.
Yeah, so I got localized IV in the back of my neck. So I've spoke about this on the podcast, and I've been doing a lot of chiropractic work and all these crazy things he's got me doing, head weighting and Pedabon thingy and all this stuff. You guys would actually look at me and laugh.
you have a good protocol.
Yeah, I have a protocol. I started in like January of this year when we got back from New York, and I've been doing it for the last, 5 months, whatever that's been, or 6 months. So, I have this head weighting thing because basically I have degeneration in my C6,
Which
C7,
we all do.
C8, which, we all, well, yeah, a lot of us do. But, fun fact, a lot of us wrestlers, as you guys have seen, a lot of, WWE wrestlers have gone to the clinic. And that was another reason why I felt more comfortable of going after seeing a lot of these people and talking to some people because, they deal with the same pain I have dealt with. So I get like a lot of numbness in my hands. And so I've been working on that. But I got the localized in my neck. I also got localized in my left knee because of that little skiing accident thingy I went through. I don't know. I think I have like more little tendonitis going on because it's very random. And I also got the IV. What did I get? Like 100 million, I think.
100 million IV.
100 million IV. And
Full body
then
IV, yeah.
full body, yep. And then I got the facial. It's called facial stem.
It's called a stem cell facial.
Stem cell
Yep.
facial. Okay,
Yeah,
I don't want to mess it up. Stem cell facial, which I'm peeling a little bit. I don't know if you guys could see, but I actually didn't peel all week. Remember after
Yeah.
it? Which funny story.
Your face looked the best.
My face didn't even
And
look
now
like
we got
it
the real, like-
Yeah, exactly.
Everyone was
That's
walking
karma.
around so jealous
Yeah,
of Mandy. Like,
that's karma.
she's
Mike
like,
was
yep.
pretty bad.
me and
Mike
Mike
was
were bad.
bad.
Me and Mike were bad.
Sabby was almost just as bad. Mike was the worst for sure. And then me and Mona and I weren't as bad, but I didn't look like I had anything. But immediately I saw results from my face right away. It was crazy. So, and it's like a microneedling process for those, that know that out there. So, and it nothing really hurt too bad. I mean, I think I was more scared of the anticipation. I'm usually a little like nervous of needles, but then if I don't look, so that's another thing to kind of tell, our followers out there that everyone thinks, if they're a little nervous, it's so fast and you're treated so well from the moment you get off the plane and the convenience of it too, which you had just stated as well. I think that's a big part of, why you guys are amazing. And it's only in Cancun. It's not a very, far plane ride for us
No,
from
it's not.
Florida.
Florida's not far
but you
from-
make it so convenient and so easy to get around, right? So like you guys took care of us and put us up in a hotel, and obviously we had drivers and everything. And it's like when stuff is like convenient like that, because I've traveled a whole lot, it just makes the whole like experience better too. So my experience was amazing. So far, I feel great. Obviously, we have some time to feel, and be recovered, I think. But I'm excited to see the recovery. And what did you get, babe?
Yeah.
Why don't you tell everyone what
I
you
want
got?
to tell you what I got, but after that, I want John and his wife to explain exactly what all the treatments are. But yeah, I got
Yeah, because they're the experts.
2 localized treatments. I got 2 on my elbow, which this elbow's been through hell. I sublexed it in Monday Night Football. I've had 3 surgeries on it. So I got 2 in my elbow. I got 1 in my lower back. And then I did the IV like you, full body IV, 100 million cells. And then I also did the facial, right?
Got
My
him to do the
skin looks
facial,
good.
guys.
Did the facial.
Not gonna lie, he's been staring at himself through the TV.
I don't know. It looks
guys,
kind of good.
and We're like,
Here's
but
the
it does
crazy
look
thing.
good.
I told Mandy this. Nothing hurt. I'm not scared of needles, really.
Oh,
Nothing
yeah.
hurt except for one thing hurt so bad. I got a little bit of stem cell in my hairline
It's
just
so
to keep
sensitive.
the strong. And boy, was that sensitive. I don't know what it was, but like I said, I'm actually overall very excited to start my training regimen again and being proactive in that because I'm very in tune to my body. And mine was more like your wife was. Mine was more proactive. I didn't have anything that really hindered me from training. Yes, I have a lot of beaten up from football and NFL, but it's nothing like that. I couldn't do anything. So for me, it's going to be really exciting to see how I feel as I work out, as I recover. In between my sets, how sore I get. So I'm excited that. But John, break down a little bit what localizing means or a full body IV means, or even like the stem cell facial. Just talk a little bit about that so people, as listeners, can understand that a little better.
So localized is the injection. So you're doing the injections into the neck, to your elbow, your knee, whatever it is. Those are getting to literally just going to the exact pinpoint where you want it to go.
Okay.
So I've done basically my full body by now over the last year. But it's going like literally it's just a needle that's going into wherever you want it to go, shoulders, knees, elbows, whatever it is, localized with stem cells, either 25 to 50 million in certain parts of the body. It depends on the damage. If you're proactive, a little less. That's with exosomes that go into the body. And then the stem cell IV, which honestly, I recommend that to anyone because that's so important, which I'm looking at the camera because I want to say this.
I like
because
this.
it's so important to do because it's full body. So it goes through all your organs. And that's the one big thing that I try to tell everybody. It goes through your whole body. It goes through your brain, through your organs, and through your whole body and fixes damage that have been done from years of possibly anything, drinking or whatever it is. It could be just going through your body and just helping with kidneys, lungs, whatever it is. So that stem cell IV goes through where it needs to, and it'll find the places that it has to go to.
Right.
That's
Any
awesome.
inflammation that you
Any
may have that
inflammation.
you might not feel it, but
Right.
it could be there. Like, you never know. Your kidney could be inflamed and you don't know.
Absolutely.
Right.
It's a beautiful
It's
thing
like
to
putting
have.
like little soldiers in your body that go and
that
just
gotta
prepare
fight.
everything
Yeah.
and
And
just
to
fight
fight.
like an army, right?
Like an
Like I always
army,
make a joke about it. It's like almost like everything you put good in your body goes in your
Mm-hmm.
body and fights off the bad stuff.
That's
So
Right.
the stem
So
cells
the stem cell
is
IV,
repairing.
So you do either 50 to 100 million. Some bigger guys got 150 million IV with the 5 billion exosomes. So the exosome is kind of like the fullback. It's kind of bringing where the cells have to go.
That's
So
awesome.
bring the cells to where it needs. Like it always
Good
goes through the
analogy.
organs first.
For the
And let's
football
say your
players.
organs are great. Let's say your lungs and kidneys, everything's functioning fantastic. It'll go where it needs. Maybe it could be a shoulder, could go there. It depends on where the damage is in your body, or if there's no damage, it could just go through wherever inflammation is. Your knees. Oh, somehow my knee feels great. So the IV is just really important. That's why we recommend that even if someone wants to come for just one injection, get the IV. Just to be preventative, to proactive.
Absolutely.
Like, you know what, just my elbow hurts. That's really it. Like, you know what, you need to do the IV just to get ahead of it.
Yeah,
Keep
the
those
IV
cells going in your body.
For sure. The IV, I feel like, definitely also helps with like so many other things that you wouldn't think about, like your nervous system. Like if anybody has anxiety, depression, it may help with that. Like I felt like that. Like I was nervous getting it. And I deal with anxiety. We have kids, like worry
We all
about that.
do,
Yeah,
of
you
course.
know,
We all
like
do, yep.
everybody has it, but it really does help with your nervous system. It calms it. Like it's great.
That's
Yeah,
insane.
there's so many things the IV can help with. Honestly, this is a big one that it's helping with fertility for women
Oh,
that are trying to get
Really?
pregnant.
Love that.
Stem cell IV can help with the fertility and helping women actually be able to get pregnant. So that's it's really it's revolutionary to think of what is capable with stem cells, the mesenchymal stem cells or the Dazawa Muse cells. Either one, it's literally revolutionary. It's going to change the world. And it's unfortunate that we're not having it in America yet. But that's the thing with Cancun. It's so easy to get to Cancun from all of America. That's one of the biggest reasons my partner started it in Cancun was because of that. It's such an easy flight from Toronto, everywhere else.
Yeah.
It's such an easy flight. So it is a luxury location. You're in the hotel zone. We're right there. Come to the clinic. You get your treatments. You go back to your hotel on the beach or on the marina, and you're enjoying yourself.
Absolutely.
That's the thing. Don't have to take a vacation from your vacation like
Right.
most of the time.
No, you're
Wherever
right.
else you go on vacation.
Location's
like, wow, I'm
huge.
tired.
Yep.
Yeah.
Like this is you're actually taking a vacation.
Yep.
Like I'm going to get treatment for a couple hours. What are you doing the rest of the day? Whatever you want.
Yeah.
You get to
do everyone.
relax in the afternoon.
No.
Yeah, it was
you're
in
right.
well, we had a great time, and I have a new bestie.
Yeah.
Guys, I
My
became
girl.
besties with their
They have
daughter,
two of the
Layla.
cutest, well-behaved kids. I
No,
will say
your
that.
kids are so well behaved.
Which
Oh,
is
they-
very
they
impressive, by the
really
way.
are.
Thank
We were
you.
talking about it. You know, like you see a lot of
We're gonna have to
kids
get
around.
some tips.
And I like well-behaved kids. I like where they're not grabbing on you when you're trying to talk to other adults. It was very impressive.
Savvy
That was
and
really
I,
good.
we have this thing like, which when we have kids, it'll obviously our perceptions or whatever. But like, your kids are so good because when you're like talking to adults, they don't like kids that get naggy and they'd be like, okay, hold on one second, I'm sorry.
Yeah.
They were like so
Yeah,
good
it
when
was
it counted.
good.
I'm very observant with that.
Yeah,
But yeah,
they are.
Layla's my new bestie, guys. You've probably seen pictures.
So-
Does she miss me?
Yeah,
John,
she-
just so one thing too, John. For the audience listening, that maybe they don't know what stem cell is or don't know where it comes from or how it's harvested, talk a little bit about exactly where you guys get your stem cell and what it is.
So it's comes from a woman that's donating their placenta from a C-section.
Okay.
So it's the Wharton's jelly from the placenta. So we vet every woman that donates their placentas in the hospitals that they're between the ages of 18 to 23.
25.
So 25. So between the ages of 18 to 25, they come, we vet them, go through a process. They're unvaccinated women, and they donate the placenta through a C-section. And then we take the placenta, bring it to our lab, and do the Wharton's jelly and do the whole process from there. So there's a misconception I know out there that they say for years and years of what it used to be, but it's not even close to true. So it's a thing. It's such a, okay, how can I say this? It's such a, okay, I'm trying to lose my train of thought.
The misconception.
People are so misinformed.
Yeah.
Yeah.
people-
That's why I wanted, yeah.
Yeah,
gonna
so
say,
people
yeah.
are so misinformed on how the stem cells come. It's not true at all. Like women have to give birth to the baby
Yeah.
healthy. The baby has to be healthy. It can't be unhealthy. It has to be-
Absolutely.
women are unvaccinated. They have to go through the whole process. We have to vet them. We go through a whole process. We donate a treatment to one of their family members because of them donating this placenta to us. So it's a whole process that we go through, and that's one big thing for us with our stem cells and how we produce them with the placenta and the Wharton's jelly is we do less passageways than other stem cell clinics. We do maybe 5 to 10. Other clinics do 40 because they do quantity over quality. And that was one big thing my partner wanted to do when he started Rejuve Stem was we wanted to do less passageways, make sure everybody goes home healthy, goes home happy, goes home feeling better. That was a big thing. We didn't start marketing or anything like that. It was just let's make sure our cells are the best.
Absolutely.
And honestly, it's amazing to see how everybody is. Like our friend Sid with his neck, my back, my neck. That sounded like a song.
My neck. My back.
We won't go any further. We won't go any further.
That was really good.
But even like some of your former colleagues have been to. I think he's told us. I won't say names, but I think he told us he went to seven different companies. And he called Chirag and he said, "I have never felt better.
Get out.
I've never felt better. I've never performed better." And
Love
that's
that.
because when you do quality over quantity, it shows. And unfortunately, like we've heard stories of people getting sick at other places,
yeah.
like for us, like
So have I.
the side effects is like just little flu-like symptoms.
Right.
Maybe did you guys?
We didn't have
Zero.
anything.
Yeah, like
I had zero. Literally
John-
nothing. I didn't even have a rush when I put it in me an IV.
Yeah,
Nothing.
No, I
John
had
never
very
has.
little.
I mean, I just got like a little chills for like maybe a few hours, but then I was fine.
Yeah. Even now with the doing the Dazawa Muse cells and the Dazawa Golden IV bag, I didn't feel anything either. And that's a new stem cells that's coming that we have access to.
And
which
speaking
is
of, sorry to cut you off.
incredible.
No, go on.
That's what I was gonna say. It was just incredible.
Love that. Well, speaking of like the misconceptions and myths that you kind of just said too, I think a lot of people too, misinformation is a big thing. I mean, people are so quick to talk about stuff that they don't know the
Well, not
information behind it,
educated,
not
yeah.
educated, right? Like, and I don't know a ton about this. Obviously, in this, I don't know a ton about this, but that's why we have you guys. But I just lost my train of thought because of that sound.
The sound messed you up,
The
babe.
sound must be out. No, because I was thinking about it. Misconceptions.
Yeah.
Testing the cells for tumors and stuff. I know there's a term. I think it's like what was that term that we?
I have no idea what you're talking
Or, I
about.
don't know. Anyway, because people ask like, they can never form tumors.
Like
right?
they
Or
testing for the
would
bad
they
cells that
test them
cause
for-
cancer or tumors.
Oh,
Like how do they
yeah,
go
yeah,
through
yeah.
that process of it, of filtering that out?
Yeah.
Absolutely. Like our lab screens them several times. They're screening the women throughout pregnancy, but then they're also screening it as they are extracting the stem
Okay.
cells.
That's awesome.
So it's cool. They
yeah.
make
It's a whole
sure of it.
process. That's the thing. So for each person that's doing the stem cells, we make sure, like, if you're coming, we start preparing ourselves within a week to 2 weeks.
Perfect.
We make sure
Wow.
for each single person that we're prepared, like, hey, like, you're locked in because we're starting the process now. We're going through the whole process.
Once you're locked, yeah, exactly.
You're locked in.
Can't
Like,
go
okay,
back.
like, yeah, like, you can't, like, it's the thing. People are like, I can't come next week. It's kind of hard because we start harvesting ourselves
Yeah.
a week or 2 weeks before. So it's a whole process that we do. And we want to, that's the big thing, is we want to make sure everybody's healthy and happy.
Well, I think you made a good point. You both said it earlier, though. The best marketing you could ever have is results. Good results, right? And that's the word of mouth. Like, you could do whatever you want, put billboards up, but if people who went there, former athletes, non-athletes, if they speak on how good they feel, that's the only marketing you
Sid.
really
Sid
need.
did it right-
Yeah.
right-
I mean, we saw Sid right here walking out the door,
That
and
was
we're
what,
grateful that we
a
saw
month
him
or
that day.
two
That was
ago,
like, yeah,
and we
maybe 2 months ago.
Right then and there, we got connected. Obviously, you and
Yeah.
Savvy talked.
So,
and
yeah.
Sid was
We were-
running like 4 miles a day in a month after.
Even his story, that's the big thing. I mean, him got close from him coming, and it was, his neck was horrible. He had to sleep with a horse blanket because he couldn't move his neck, and he didn't want to move because he would just jolt and be in such pain. So he was so bad. And literally when he came, I heard in his voice before he came, I was like, Sid, please come. Please just come. And he called me 3 weeks later. He's like, John, I'll be honest with you. I didn't think this was going to work. I thought I was at that neck fusion surgery. He's like, I just ran 3 miles.
wow.
That's
Well,
awesome.
that's the thing too with surgery, and like obviously, no one wants to live with chronic pain. Chronic pain
Nobody.
is the absolute worst. I don't care what anyone says, but the only result is surgery. But who knows if the surgery is even going to work, or how to maintain and recovery takes you out of work. It takes you out of doing what you love to do, working out, all these things. Whereas, our recovery for this, and that's actually something we'll talk about too, because Sabby and I are big trainers, and we're a little skeptical. Can't talk. I just jinxed myself from the last one. Skeptical because of taking a little time off, but you want your body to not have as much new inflammation in there, so the stem cells
Yeah,
can
you'll
get it.
go to work for a little bit,
Right,
work
yeah.
on your body.
So, but I
absolutely.
mean,
So it's
taking
work.
a week off or 10 days, whatever it is, like it's good to rest your body
Absolutely.
and recover. And we're excited to get back into the gym after because it remotivates
And
us
that's a
as
big
well.
thing, like we and me discussed, Seb. Like a week to 2 weeks, I would say, take off.
Yep.
Let your body rest. Get the cells going in your body. And that thing, you kind of want the inflammation in your body because the cells are getting to work.
Yeah, when it
So
comes
when
up,
you start training it a little bit, if you do a little research on it, it's actually really helpful for training and muscle growth and bringing back the body that you should have. And that's a big thing with the 1 to 2 weeks off, and you're ramping it back up. You start feeling better, and you're like, wow, you feel the cells going to work.
Yeah.
Like for me, like I said, I just did the Dazawa Mu Cell IV, and I felt like my back crack, my shoulder crack. It was like kind of going back into place. Because this is only a week.
And he only took a deep breath, guy.
Yeah, I took a deep breath.
And I heard
all of
it.
a sudden I heard
Like, I
crack.
was like,
and I
wow.
couldn't believe. I'm like, already this is working. Like the golden IV bag, the Dazawa golden IV bag is just going to change everything. You just do an IV and it's going to go through where it needs to go. 100
Yeah.
million Mu cells.
that's unbelievable.
And 100 million Dazawa exosomes and 1 trillion Dazawa exosomes going through your whole body and it's going where it needs to go. It's going to literally just take down. And the big thing with the Dazawa Mu cells is it was founded for CTE, Alzheimer's, multiple sclerosis, Parkinson's disease, these different diseases that there's been no help for.
Right. And the more aggressive ones that we've seen people just be, debilitated from, which is crazy to think like there could be relief for them,
Yeah,
They could get
absolutely.
their body to potentially get that inflammation down,
Yeah.
to actually
I'm
have,
like that at this
quality
point.
of life back.
Like,
You know-
I couldn't believe it.
You know what's exciting? Two things. One is I hope America catches up and allows this because, we all know, I don't want to get into it right now in this podcast, but we all know our world is run by pharma, right? And that's just the shitty part of it. And it sucks. They want us to not be healthy. But that being said, I think was awesome too, is talking to you two who own a clinic, who've done a lot of research. What I think is kind of exciting is they haven't even tapped into the full potential of what this can really do from a, benefit of healing, anti-aging, like you just said, Alzheimer's. That's things that in America, right, quote unquote,
Zero cure.
zero cure, or
Can
we'll
never
give you a
find a
prescription
cure.
drug for, and it's so funny. Like even like I cringe and I can't stand when you see commercials on TV for like diabetes or getting this medication. They don't talk about fitness.
No.
They talk about, I'll give you a medication. You can still be fat and out of shape, but I'll give you a medication to lower your A1C. That bothers the shit out of me, bro.
I have a
Why don't
story.
you do a commercial on how to get back in shape, how to eat correctly? maybe do stem cell. That's something we don't preach here in America. So I'm very passionate about this, and the more I learn about it, I get more excited about it. And that's why, I'm grateful for what we did. I'm really excited to really see how I feel now that I start my new program and get going and push my body to a level where see how far I can go again in that aspect of it.
I love that you brought up the fact of the commercials, because when John had his tricep surgery, one of the prescriptions that they prescribed him actually could cause cancer, and our life insurance was about to drop us.
Isn't that crazy?
I never took it. I never took the painkiller.
So I
but
had
they
to go to
prescribed
see.
it to me, and they came up.
I had to go and make sure that he had proof that he didn't
take it.
I didn't pick it up,
Isn't that crazy?
which is nuts.
That is so
But yeah,
crazy.
take
Oh,
this
like
painkiller,
this may
though.
help you, but it may cause cancer too.
Right.
Hey, how about that?
Take this for some temporary relief or whatever, and
Yeah.
then,
I
but
wouldn't
don't
take
worry
a
about the
painkiller
long
ever.
side effects.
Terrible.
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 That's why you mentioned about the commercials, because a couple weeks ago I saw a commercial. It was probably like 7:00 at night, and I saw a commercial. It was a cartoon, and my son was with me, and it was for some drug for AIDS.
Come on.
And it was cartoon. He was like, Dad,
Cartoon?
what's this about? I was like,
Really?
What?
Yeah, like you're not advertising for
Yeah.
children. So
Yeah, like,
why
what's
are
your
you doing it?
audience?
Yeah,
Why are
what's
you
your
making it a
audience?
cartoon?
Read the
And my
room.
son's watching it. I'm like, why are you watching this?
Yeah, I would highly recommend to, if anybody out there is getting recommended by their doctors or anybody to get a surgery, I would recommend do stem cell first. That's my recommendation, because listen, we all know there's risks in all surgeries. I had a basic scope in my elbow, and I ended up being on the table for 5.5 hours because the device snapped off inside me and vanished.
Yeah, with nerve
literally,
damage.
literally,
So like,
literally probably ruined my whole WWE career because it put me on a shelf for 2.5 years. But that's a whole nother story. But I'm a big believer in, surgery is kind of the last resort. So I highly recommend anybody listening out there, if you're fighting chronic pain, if you're fighting any past injuries, or even if you're being proactive and you want the anti-aging aspect of it, please visit Ace Rejuve. You have another clinic, right? You have Cancun, and where's the other one? Guadalajara. Awesome.
2 clinics. You can
Yeah,
find more
healing
information,
holistically is the way to go. I mean, it's holistic, anti-aging, holistic
100%.
healing. Like, you're not pumping yourself with all of these chemicals that they prescribe you, you know?
Right.
So,
And that's the thing, like we were saying before, misinformation as well. Think about it from this perspective. Like in America, say, oh, we do stem cells. You don't do stem cells. They're taking stem cells from your own body, or they're giving you exosomes, which aren't going to do anything. We lose our stem cells after a certain age. We keep deteriorating over time. You hit 23 to 25, it keeps going down. By the time you're 30, they're basically gone. So anybody's like, oh, I'm doing stem cells in America. You're not. You're just doing your own stem cells in your body. You're putting the same things back in, and it's going to do nothing.
and they're
So there's a
tired
misconception,
and worn out.
yeah.
yeah. So what's the point of
misconception.
taking them out if they're no good anymore and putting them back
They're
in?
not going to say that in America.
Of course,
'Cause
yeah.
They want to make money. Someone literally called me a couple weeks ago, like, hey, they want to do stem cells in America. It's $10,000 injection. Like, that's not.
That's not. No, you make a good point though. It's like if your stem cells are decreasing through your age, right? Let's say you're 50 years old and you want to extract, stem cell from 50. Well, he's 50 years old.
Yeah, what's it going to do?
He's 50 years old already, right? So it's like, yeah. So what are you doing?
Yeah.
No, I agree with that, man, and that's something that's like I said earlier. I think, and still even now, like I follow Gary Brecka. I follow guys that help America kind of heal on their own. And the funny thing is, we still learn so much every day about the human body, right?
Yeah.
So think about it, we're still evolving so much. And when you hear about stem cell, I feel like the sky's the limit in that. They don't even know all of it.
I
It
feel
cures.
like they just touch the surface.
Yeah, they
and
know
don't
what it
even,
cures from maybe an ounce, oh, this guy couldn't walk, now he can walk. His back was, that's really awesome to see. But that's what I think is so exciting about where this can really go in the future, right?
Absolutely.
so-
I mean, the
So
first
nice.
time I heard about it was when we were first pregnant. Like, they were like, hey, do you want to store your child's cord blood? And I have to say, I was so naive and uneducated in it. So I had to like really dive in. And that was the first time I actually kind of even scratched the surface on it. And they obviously didn't know what they know now.
No, not even close.
Well,
It's crazy. Well, it's also, we love the fact that another power alpha
Yeah,
couple
we like
here,
it.
and your guys' dynamic. Obviously, you guys, are in on this together. How has it been as on a more personal level working together? Because Abby and I
Great
obviously
question.
are always with each other,
That's a very good
and
question.
our fans love to see that dynamic, and they also love to see the
I'll let you
authenticity.
answer that
Yeah,
one.
exactly. But also, we're real people, and
Yeah.
obviously we have our real struggles and all that, but it's really nice to see another couple work together and be passionate about the same thing and really want to see other people help. And I could tell, you know, what you both bring to the table. Like you have your little, you know, pros and cons of like what you guys want to work with or whatever it is. So like, how has that been so far, your experience? We'll let Christine go first.
Do tell.
Christine, you go first.
No, I mean, I can't say a bad thing about working with my husband. Like I told you, his light in his eyes is crazy. Like I've seen him transform, you know. I've seen him be rejuvenated, pun intended. But, you know, I've also seen like a different side of my husband that like, you know, I've known my husband for 21 years.
Wow.
So like, I love this chapter for us and I love working with
That's awesome.
Yeah.
I mean, you know, it could have its moments. We could be stressed out and, you know, we could butt heads, but we're a really great team and, you know, regrouping and like
Love that.
getting it back.
Yeah. So John, talk about having another alpha next to you. That's what I have sometimes. Sometimes we
You guys
clash.
ever
I was gonna say
Like
that
us
was
two?
your side, but
I want to hear your side now.
no, honestly, it has been great because we're a team in life. So in the business, it's the same thing. Don't get me wrong, yes, we do butt heads. Sometimes we fight each other a lot. Of course.
Normal.
Of course. We quit a lot. So like, you know, I'm not doing this with you anymore. So it's just, yeah, but that's the thing. It's, we know we're a team. We're going to be in this together. It's just fun. That's the cool thing. We're working together as a couple. We're in love. And at the same point, we're in love with what we're doing. So it's a passion.
That's important.
It's a passion for both different sides. Passion in life to be together. It's passion for business. And this is such a special time in our lives. Like you said, like the light of my soul has changed. Like I feel like such a breath of fresh air being involved now with Rejuve and being owner of the company and taking the company to another level because it means something to me.
Yeah.
It means
Yeah, and
something
the
to me. For me to
purpose.
feel good and to have other people feel the same way as me, that means something to me.
Absolutely.
When I get calls or texts, thank you so much. Thank you so much for saving my life. I can't thank you enough. I can actually get on the ground and play with my son now.
Wow.
I actually just took him to a trampoline park and I'm playing around with him. I can't thank you enough.
Yeah.
People call me crying.
That's awesome.
Like that means the world.
That's what life's about.
That's what it is.
100%.
Literally,
Yeah.
that's what life's about. And it's such a, like I said, a breath of fresh air. It's such an impactful treatment that it could really change lives. Like we just said about fertility, it can help someone get pregnant. A woman
Which
get
is
pregnant,
crazy.
which is crazy.
Yeah.
That can actually help.
Help
so
someone
many
with
different-
diabetes. It could,
Yeah.
You know, there's such an endless thing that it could do. But what I think I see in my husband is like my husband lost my father-in-law, his father, 10 years ago. What I see, every person that he helps, it's almost as if like he's helping him. He couldn't because we weren't informed of this then, you know.
Yeah.
Yeah.
Like my father-in-law had sleep apnea, he had diabetes, he had a bad infection in his leg. Like these are things that could have helped him and
Yeah.
prolonged his life. So I just feel like every time I see him helping somebody down there, it's like his soul work. Like, you know, this is like something that he's just
And your father's looking over you. And
Yeah,
he's proud
that's,
for
That's
sure.
the big thing is like I know he's proud of me what I'm doing because it is like it's funny because I actually had an article written about me and that was in the article. That was the writer was stating that he's like it kind of it's like you're speaking, but he's like it seems like you're speaking. It's like your dad is speaking to you while you're saying everything. He's like it's just my dad has the biggest impact in my life. He's my best friend. Passed away 10 years ago, actually 5 days before Christmas.
Oh.
Oh, it's this Christmas is gonna be 10 years. So it's such a it's always Christmas is so special for us, and my dad loved Christmas. We always decorated the house and stuff outside and stuff. So it was meaningful. My dad was my best friend. So you're right, 100%. Like it really is. Like every time I help someone, that's what means something to me because I could help my dad. We've had case studies that someone had sleep apnea, and it's helped diminish that. It's helping bring.
No, we've actually had a patient, and we have to like kind of bring this to light. But we had a patient that he went back and put his CPAP on, and what was his reading? Do you remember?
I forget his reading, but yeah, I went down. His doctor was in shock.
Like
Get out, really?
Yeah,
For
like
sleep apnea?
within days.
Within days. He was like,
Unbelievable.
"I couldn't believe it."
Because there really isn't. Is there like an actual cure for sleep?
They just
besides
have
that machine.
the machine.
But, like
that's really
it-
it.
most people don't want to go to that.
A couple days later, he texted my partner. He's like, "John, I'm sorry," because I texted Vivek. He's like, "I can't believe this." He's like, my machine, my levels went down. So
Wow.
he was in shock.
That's insane.
Well, listen, guys, anybody listening to this podcast, this is not a staged event. You know, we have 4 people here that all did stem cell. We can't
Real
thank them
results,
enough.
real people.
Yeah, for joining the podcast. Before we wrap this up, thank you for both of you joining. If you guys want to talk about Rejuve, where it's located, how you can get in contact with you guys, kind of sell the brand, go ahead and clear that out before we finish this podcast.
Yeah.
And
So
we also, sorry,
go.
but also I wanted to mention in the comment section, we have our code as
Yep,
well for
we'll
you
have
guys.
our code for you
to,
guys.
Get a little discount, and if you're, ready to take on this next adventure and get your health in check. So make sure you check that out as well. But
Go ahead, you guys.
So we're located in Cancun, Mexico, right in the hotel zone. You can go to our website, rejuvestem.com. I'm on Instagram at John Marola. My beautiful wife is
Christina _Marola. And obviously Rejuve is on Instagram as well. What else?
Well, Christina and John, thank you so much.
Well,
Honestly,
you
you
guys
guys
for
did a great
joining us.
job. And like I said, we thank you for treating us like family and treating us well. And we're excited to help you guys grow this because this is our passion as well. And we can't thank you enough. And I'm excited to let you guys know how I feel.
Absolutely.
It really is.
I'm
So,
excited
excited.
too.
yeah, so it's awesome.
see
But
the results. So thank you guys so much for joining us.
Thank you.
you guys for trusting us and believing in us and coming.
Yes,
It's really
of
fun.
course.
And you got a new bestie from it. So.
And I got a new bestie. My babe.
She's already planning her birthday party. She's
I'm coming. Is it going to be in Florida?
yeah, probably.
I'm coming. No, thank you guys for listening. We appreciate it. If you want to check out, make sure you check out Rejuve STEM on Instagram, and we'll be posting a lot about our results. And I have a few vlogs that I want to post as well. Our whole experience, which was amazing. And check the caption below for our code as well. And hear us out on Apple Podcasts and Spotify as well. So thank you. Bye.